vaccine, the treatments and the prevention of November corona. So, what to do? Unless you've been in close contact with someone who has the coronavirus, which right now typically means a traveler from Wuhan, China who has the virus, you are likely to be safe. While we don't yet understand the particulars of how this virus spreads, coronaviruses usually spread through droplets containing large particles that typically can only be suspended in the air for 3 to 6 feet before dissipating. By contrast, measles or varicella, chickenpox, spread through smaller droplets over much greater distances. Some coronaviruses also have been found in the stool of certain individuals. So it's likely that coughs or sneezes from an infected person may spread the virus. It's too early to say whether another route of transmission, fecal-oral contact, might also spread this particular virus. If a patient with suspected 2019 nCoV infection tests positive for another respiratory pathogen, after clinical evaluation and consultation with public health authorities, they may no longer be considered a person under investigation. Management: no specific antiviral agent is available for the treatment of this infection, and there is no vaccine. Treatment is supportive and includes supplemental oxygen and conservative fluid management, as indicated by clinical condition. WHO provides detailed guidance on such supportive measures and cautions that severely ill patients should be treated empirically for other possible causes while diagnostic test results are pending. Infection control measures are an integral part of management. Precautions should be instituted as soon as 2019 nCoV infection is suspected. Provide the patient with a face mask and place the patient in a closed room, preferably with structural safeguards against airborne transmission. Persons entering the room should follow the standard, contact, and airborne precautions. Patients managed at home are encouraged to self-isolate to a single area of the house, preferably with a separate bathroom, and to wear a face mask during any contact with household members. The patient and all household members should follow a diligent hand and cough hygiene. The best ways to protect yourself from this deadly virus. There is currently no vaccine to prevent coronavirus disease in 2019, COVID-19. The best way to prevent illness is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday preventive actions to help prevent the spread of respiratory diseases, including: avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Follow CDC's recommendations for using a face mask. CDC does not recommend that people who are well wearing a face mask to protect themselves from respiratory diseases, including COVID-19. Face masks should be used by people who show symptoms of COVID-19 to help prevent the spread of the disease to others. The use of face masks is also crucial for health workers and people who are taking care of someone in close settings. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. In winter, in fact, we are much more likely to get influenza B, the flu, than any other virus. 1 in 10 people have influenza each flu season. It's still not too late to get a flu shot, an easy step toward avoiding the flu. If you do get the flu despite having gotten the vaccine, studies show that severe illness, hospitalization, ICU admission, and death are less likely to occur. Scientists are working hard to understand the virus, and Chinese health authorities have posted its full genome in international databases. Currently, there are no approved antivirals for this particular coronavirus, so treatment is supportive. For the sickest patients with this illness, specialized, aggressive care in an intensive care unit, ICU, can be life-saving. Zoonotic diseases are common everywhere in the world. One way they do this is through creating food safety regulations. These regulations reduce the chances of getting a zoonotic disease from something you eat in a developed country. There are also ways to help prevent getting any kind of zoonotic diseases. These include the following. Wash your hands diligently. Use insect repellent or other methods to keep mosquitoes, fleas, and ticks away. Practice safe food handling, which includes washing off all produce before eating it. Avoid being bitten or scratched by an animal. Have your pets vaccinated and take them for regular annual visits to the veterinarian. Talk to your veterinarian about appropriate flea and tick preventatives for your pets. Check for ticks when you've been outside. Following more tips will decrease health risk. Don't eat, drink, or touch your eyes or mouth while you're handling or in close contact with animals. Use gloves if you need to handle an animal that is or appears to be sick. Keep any areas where animals are kept clean and sanitary. Be aware of areas where animals or insects might be when you're out in nature, especially when you participate in activities like hunting and camping. Don't handle or approach any animal in the wild that appears sick. Be sure to contact animal control or the local government to have the ill animal removed. Hand washing, easy hacks. Hand washing is one of the best ways to protect yourself and your family from getting sick. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout an entire community, from your home and workplace to childcare facilities and hospitals. When? Wash your hands often to stay healthy. You can help yourself and your loved ones stay healthy by washing your hands often, especially during these key times when you are likely to get and spread germs. Before, during, and after preparing food. Before eating food. Before and after caring for someone at home who is sick with vomiting or diarrhea. Before and after treating a cut or wound. After using the toilet. After changing diapers or cleaning up a child who has used the toilet. After blowing your nose, coughing, or sneezing. After touching an animal, animal feed, or animal waste. After handling pet food or pet treats. After touching garbage. How? Follow these steps to wash your hands the right way. Wet your hands with clean, running water, warm or cold, turn off the tap, and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. Rinse your hands well under clean, running water. Dry your hands using a clean towel or air dry them. Use hand sanitizer when you can't use soap and water. You can use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. Washing hands with soap and water are the best way to get rid of germs in most situations. If soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. You can tell if the sanitizer contains at least 60% alcohol by looking at the product label. Sanitizers can quickly reduce the number of germs on hands in many situations. However, sanitizers do not get rid of all types of germs. Hand sanitizers may not be as effective when hands are visibly dirty or greasy. Hand sanitizers might not remove harmful chemicals from hands like pesticides and heavy metals. Caution: swallowing alcohol-based hand sanitizers can cause alcohol poisoning if more than a couple of mouthfuls are swallowed. Keep it out of reach of young children and supervise their use. How to use hand sanitizer. Apply the gel product to the palm of one hand. Read the label to learn the correct amount. Rub your hands together. Rub the gel over all the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds. Does hand sanitizer protect you from the Wuhan virus? What about antiseptic wipes? The best way is actually to wash your hands with soap and water, said Dr. Carlisue Marimuthu, Senior Infectious Disease Consultant at the National Center for Infectious Diseases, NCID. Soap and water reduce the amount of all types of germs on your hands, so frequent hand washing should keep them clean. But if you have no access to soap and water, then hand sanitizers with at least 60% alcohol content is a good alternative. To be effective, you must use enough to cover your hands. Rub it over your hands for about 20 seconds, and leave it to dry naturally instead of wiping dry. Sanitizers with 60 to 95% alcohol clean much better than those with less alcohol or no alcohol in them, according to the United States Centers for Disease Control and Prevention. It too says soap and water are better, as sanitizers do not eliminate all types of germs. As for the usefulness of antiseptic wet wipes, Dr. Marimuthu said they should be used for cleaning environmental surfaces and not for hands. A virologist from the Queen Mary University of London did a study on wet wipes some years back and found that in some cases, using wet wipes actually spreads germs rather than removing them. To be at all effective, the wipes need at least 40% alcohol. Those that are drying out should be discarded. Hand sanitizer sold out? Here's how to make your own. With concerns about COVID-19 running high, supplies of hand sanitizer at local stores may start to run low. If they run out, is it safe to make your own, and will DIY hand sanitizers protect you against coronavirus infection? In a pinch, could homemade hand sanitizer do the job? Possibly, but you have to use the right recipe, experts say. The alcohol in hand sanitizers lends those products their microbe-busting power, and the CDC recommends that sanitizers contain 60% to 95% alcohol in order to eradicate germs. Sanitizers work best on clean hands and may be less effective when hands are greasy or visibly dirty, according to the CDC. Adding an emollient such as aloe vera gel or glycerin will prevent the hand sanitizer from drying out your skin, and essential oils will give the mixture a pleasant smell, according to a recipe shared by CBS News. Based on the ratio recommended by the CDC, a homemade sanitizer made with 0.67 cups, 161 milliliters, of isopropyl alcohol would use 0.33 cups, 79 milliliters, of emollient, CBS says. In other words, if your solution is 2/3 91% isopropyl alcohol and 1/3 emollient, the alcohol content of the mixture will be 60.6%, 91 times 2/3. For higher alcohol content, you could make a solution that's 3/4 91% alcohol and 1/4 emollient, producing a mixture with an alcohol content of 68%, 91 times 3/4. A handmade hand sanitizer recipe from the World Health Organization, WHO, for local production in large quantities in parts of the world where clean water and commercial sanitizer are scarce or unavailable, describes a solution with much higher alcohol content. That mixture is made of 35 cups, 8,333 milliliters, of 96% ethanol, 0.6 cups, 145 milliliters, of 98% glycerol and 1.7 cups, 417 milliliters, of 3% hydrogen peroxide, which is added to reduce bacterial contamination of the sanitizer and is not an active substance for hand antisepsis, the WHO says. Make a solution that's 3/4 91% alcohol and 1/4 emollient, producing a mixture with an alcohol content of 68%, 91 times 3/4. Protecting yourself from coronavirus, the two types of face masks that can help. A face mask can protect you from contracting a cold, flu or other viruses, just make sure you get the right kind. Walk around any crowded area during flu season, and you'll see a common sight, people wearing medical face masks to protect themselves from pollution, germs and other contaminants. With the outbreak of a new coronavirus, these face masks are flying off the shelves in almost every drugstore. But do they really work? Although disposable face masks block large particles from entering your mouth, a more tight-fitting N95 respirator mask is far more effective at protecting you from airborne illnesses. And if you really want to prevent viral infections, your best bet is to take all of the precautions you can, including frequent hand washing and avoiding other sick people. Face mask versus respirator. If you've ever been to the dentist, surgical face masks will look familiar. Healthcare professionals use them to prevent the splashing of fluids into their mouths. They're loose-fitting and allow airborne particles in. People commonly wear face masks in East Asian countries to protect themselves from smog and respiratory diseases, but these masks aren't designed to block tiny particles from the air. A face mask's main purpose is to keep out the liquid of another infected person's sneeze or cough from entering your mouth or nose. Gross, I know. Wearing one can protect you from getting sick if you are in close contact with someone who is ill and also help prevent you from spreading your illness to someone else. Face masks can also help prevent hand-to-mouth viral transmissions because you can't directly touch your own mouth while wearing one. However, virologists say that surgical face masks cannot block airborne viruses from entering your body. The N95 respirator. For that, you'll need a respirator, a tight-fitting protective device worn around the face. When people say respirator, they're usually referring to the N95 respirator. The N95 respirator gets its name from the fact that it blocks at least 95% of tiny particles. Several brands manufacture N95 respirators, and they come in all different sizes. Though these masks offer limited protection from coronaviruses, the name of the mask says it all. The 95 means the mask, if properly fitted, and that fit factor presents a big if, can filter out particles down to 0.3 microns 95% of the time. A human hair is roughly 100 microns in diameter. Human coronaviruses measure between 0.1 and 0.2 microns, which is 1 to 2 times below the cutoff. To efficiently protect yourself from coronaviruses, you would need to wear a full face mask with a high-efficiency particle air filter. But such HEPA filter masks cause what usually called quite a discomfort in short order. N95 masks are difficult to put on for people who aren't medical professionals. If you've put the mask on the right, it gets hot and stuffy, so a lot of people take it off before it can do any good. Another study showed that respiratory masks are helpful in preventing viral infections, but only when combined with frequent hand washing. The bottom line. A government-approved N95 mask can lower your chance of viral illness, but only if you use it correctly. Plus, you should still continue other common-sense preventative measures, like washing your hands frequently, not touching your mouth or nose, and avoiding other sick people as we have mentioned. If you don't have access to an N95 mask, a surgical face mask will suffice. Though, as noted, you'll get less protection from airborne viruses if you wear a face mask. Experts say that wrapping a scarf or other cotton fiber around your nose and mouth can also work in a bind. Do respirators really protect against the new coronavirus? The new coronavirus is officially called 2019 nCoV, and it's part of a group of coronaviruses that includes both the common cold and the deadly SARS. The novel virus is spread through coughing, sneezing or contact with a sick person. So, the same logic still holds. A respirator, if worn correctly and combined with other virus prevention methods, can help lower the risk that you catch the disease. The CDC only recommends that people wear face masks or respirators if they're traveling in China or have already contracted the virus. However, if you're in a place where coronavirus is present, or are especially concerned about the disease for another reason, a respirator can't hurt. Viruses, including the coronavirus that scientists believe may be the cause of SARS, are so tiny that they can easily pass through such barriers. Several studies even have shown that surgical masks fail to prevent transmission of the much larger Mycobacterium tuberculosis, which causes TB. Any mask clearly wards off one bug, fear. Confoundingly, the sight of so many people wearing masks also spreads fear. And there's no measure of collection efficiency or fit factors that can help humans out of that pickle. Use an N95 mask even if you cannot see the particles because they may be too small to see. N95 masks do not protect you against chemical vapors, gases, carbon monoxide, gasoline, asbestos, lead or low oxygen environments. N95 masks are tricky to put on, so make sure to check out the following guide about how to fit one to your face perfectly. Hall says that the key is to wear the mask firmly around your nose and mouth without any gaps. And once it's on, leave it on. A respirator that's only worn sometimes isn't nearly as effective. Wearing the N95 mask, 10 steps to follow. Always read and follow the manufacturer's directions when using an N95 mask. It must cover both the nose and mouth to keep you from breathing in mold and dust. If it does not have a snug fit, it will not work properly. 1. How to make sure the mask fits. Do a user seal check, including both positive and negative pressure checks, to verify that you have correctly put on the mask and adjusted it to fit properly. The correct fit of the mask requires contact with smooth skin. It will not work properly for people with beards or facial hair. Even one-day beard growth has been shown to let air leak in. Always use both straps on the mask to hold it in place to keep air from leaking around it. 2. Trim your facial hair before wearing your mask, when possible. If you know you need to wear an N95 mask, shave off all facial hair. It can get in the way of the mask and prevent a tight, sealed fit, which will compromise the effectiveness of the mask. If it's an emergency situation and you don't have time to shave, fit the mask on as best you can. 3. Wash your hands well before putting on your mask. Try to follow all the details you have learned from previous modules. Cup the mask in one hand and place it over your mouth and nose. Place the mask in the palm of your hand so that the straps face the floor. Set it over your nose and mouth with the nose piece fitting over the bridge of your nose. The bottom should go just under your chin. Try to touch only the outside and edges of the mask to keep it clean. 5. Pull the bottom and top straps over your head. If your mask has 2 straps, pull the bottom one over your head and secure it around your neck, just under your ears. Continue to hold the mask tightly against your face with the other hand. Then, pull the top strap over and set it above your ears. 6. Mold the nose piece around the bridge of your nose. Set your first 2 fingertips on either side of the metal nose clip at the top of your mask. Run your fingers down both sides of the strip, molding it along the bridge of your nose. If your mask doesn't have a nose piece, simply make sure the fit is tight and snug around your nose. 7. Breathe through the mask and test for leaks. Set both hands against the mask and take a breath to make sure that it seals against your face. Then exhale, feeling for any leakage from the nose piece or around the edges. If you feel air leaking from the nose area, remold the nose piece. If it's coming from the edges of the mask, adjust the placement of the straps on the sides of your head. If your mask still isn't completely sealed, ask a friend or family member for help, or try a different size or model. 8. Remove your mask by pulling the straps over the top of your head. Without touching the front of the mask, pull the bottom strap over your head. Let it hang down over your chest. Then, pull the top strap over. You can either throw the mask away or store it in a clean, sealed container or bag. Avoid touching the mask itself, as it might be contaminated. 9. Throw away your mask if you used it in a medical setting. If you used your mask with an ill patient, or as a way to prevent getting sick in an outbreak, the outside of your mask is likely contaminated. Disposing of it properly will ensure that you won't come into contact with contaminated particles. Carefully hold the mask by the straps and throw it away in a trash can. 10. Re-wear your mask as long as it stays dry and fits tightly. If you're using the mask to protect from environmental hazards and it hasn't come into contact with harmful germs, it should be fine to wear again. Test the seal of your mask each time you put it on to make sure it still fits snugly. Store your mask in a clean, sealed container or bag and make sure it doesn't get bent out of shape by surrounding objects. Negative pressure check. Place both hands completely over the mask and inhale sharply. Be careful not to disturb the position of the mask. The mask should pull into your face. If air leaks around your face or eyes, adjust the nose piece and straps and repeat the positive pressure check. Positive pressure check. Put your hands over the mask and breathe out sharply. If your mask has an exhalation valve, like the one pictured above, be sure to cover the exhalation valve when you exhale. No air should leak out of the mask if it fits properly. If air leaks out, readjust the nose piece and straps and repeat the negative pressure check. When to throw out the N95 mask. As the N95 mask gets clogged, it becomes more difficult to breathe. When this occurs, throw it out and use a new one. Discard the mask if it is wet or dirty on the inside, if it is deformed, or if the filter is torn. A deformed mask may not fit properly. An N95 mask cannot be cleaned or disinfected. All we need, immediate vaccination for November corona. Faster vaccine development. Several groups started working on a vaccine for 2019 nCoV shortly after Chinese scientists shared the virus's genetic sequence in an online public database on January 10. This type of vaccine can still elicit a protective immune response in a person. But because the protein is only a small piece of the virus, it doesn't cause illness. Scientists are just getting started working, but their vaccine development strategy will benefit both from work that has been done on closely related viruses, such as SARS and MERS, as well as advances that have been made in vaccine technologies, such as nucleic acid vaccines, which are DNA and RNA-based vaccines that produce the vaccine antigen in your own body. This work involves designing the vaccine constructs, for example, producing the right target antigens, viral proteins that are targeted by the immune system, followed by testing in animal models to show that they are protective and safe. Once safety and efficacy are established, vaccines can advance into clinical trials in humans. If the vaccines induce the expected immune response and protection and are found safe, they can be mass-produced for vaccination of the population. Currently, we lack virus isolates, or samples of the virus, to test the vaccines against. We also lack antibodies to make sure the vaccine is in good shape. We need the virus in order to test if the immune response induced by the vaccine works. Also, we need to establish what animals to test the vaccine on. That potentially could include mice and non-human primates. Vaccine development will likely take months. Inactivated coronavirus vaccine. The immunogenicity and efficacy of inactivated SARS-CoV vaccines have been established in experimental animals, and one such vaccine is being evaluated in a clinical trial. However, the development of inactivated vaccines requires the propagation of high titers of infectious virus, which in the case of SARS-CoV requires biosafety level 3 enhanced precautions and is a safety concern for production. Additionally, incomplete inactivation of the vaccine virus presents a potential public health threat. Production workers are at risk for infection during handling of concentrated live SARS-CoV. Incomplete virus inactivation may cause SARS outbreaks among the vaccinated populations, and some viral proteins may induce harmful immune or inflammatory responses, even causing SARS-like diseases. Live attenuated coronavirus vaccine. To date, live attenuated vaccines for SARS-CoV have not been evaluated. However, systems have been developed to generate CDNAs encoding the genomes of CoVs, including SARS-CoV. The panel of CDNAs spanning the entire CoV genome can be systematically and directionally assembled by in vitro ligation into a genome-length cDNA from which recombinant virus can be rescued. This system has been used for genetic analysis of SARS-CoV protein functions and will enable researchers to engineer specific attenuating mutations or modifications into the genome of the virus to develop live attenuated vaccines. While live attenuated vaccines targeting respiratory viruses, including influenza viruses and adenoviruses, have been approved for use in humans, the observation that infectious virus is shed in the feces of SARS-CoV infected individuals raises concerns that a live attenuated SARS-CoV vaccine strain may also be shed in feces, with potential to spread to unvaccinated individuals. Another concern is the risk of recombination of a live attenuated vaccine virus with wild-type CoV. However, there may be ways to engineer the genome of the vaccine virus to minimize this risk. S-protein-based coronavirus vaccine. The roles of S-protein in receptor binding and membrane fusion indicate that vaccines based on the S-protein could induce antibodies to block virus binding and fusion or neutralize virus infection. Among all structural proteins of SARS-CoV, S-protein is the main antigenic component that is responsible for inducing host immune responses, neutralizing antibodies and/or protective immunity against virus infection. S-protein has, therefore, been selected as an important target for vaccine and antiviral development. Although full-length S-protein-based SARS vaccines can induce neutralizing antibody responses against SARS-CoV infection, they may also induce harmful immune responses that cause liver damage of the vaccinated animals or enhanced infection after challenge with homologous SARS-CoV, raising concerns about the safety and ultimate protective efficacy of vaccines that contain the full-length SARS-CoV S-protein. Combination vaccines against coronavirus. Combination vaccines have also been evaluated for their ability to augment immune responses to SARS-CoV. Administration of 2 doses of a DNA vaccine encoding the S-protein, followed by immunization with the inactivated whole virus, was shown to be more immunogenic in mice than either vaccine type alone. The combination vaccine induced both high humoral and cell-mediated immune responses. High NAb titers were also observed in mice vaccinated with a combination of S-DNA vaccines and S-peptide generated in Escherichia coli. Combination vaccines may enhance the efficacy of DNA vaccine candidates. The development of vaccines targeting this virus will help, in the event of its re-emergence, to potentially stop its spread before it wreaks the social and economic havoc caused by the previous outbreak. Furthermore, lessons learned from the generation of these vaccines may aid in the development of future vaccines against known and newly identified coronaviruses. If you think you have the coronavirus, here's what to do. Stay home if you have mild symptoms. People with mild symptoms, even if they haven't tested positive for the novel coronavirus, such as mild fever, cough or sore throat, should isolate themselves at home while they are sick. That means don't go to the office, school or public areas, and avoid using public transportation or ride-sharing services. While at home, you should also separate yourself from other people as much as possible, for example, by staying in a specific room, and using a separate bathroom if one is available. In addition, you should limit contact with your pets until more information is known about whether the virus can spread to other animals. However, there are currently no confirmed reports of people transmitting the infection to their pets. Seek medical care for more serious symptoms. Those with COVID-19 should monitor their symptoms and seek medical care if their symptoms worsen. Symptoms that require medical attention include high fever, weakness, lethargy or shortness of breath. Medical care for these symptoms is particularly important for those who are older or who have underlying medical conditions, who appear to be most at risk for serious complications from COVID-19. Take precautions when visiting the doctor. Before going to the doctor, the CDC advises that you call ahead and let your physician know that you have or may have COVID-19. This way, your healthcare provider can take steps to prevent others at the office from being infected. You may also need to enter the facility through a separate entrance or visit a designated area, such as a triage tent. Wear a face mask when around others. Many people have donned face masks to protect themselves from the virus, but health officials generally do not recommend face masks for people who are well. The only times you should wear a face mask are if you are sick with the virus or caring for other people who are sick. In particular, people with COVID-19 should wear a face mask if they visit their doctor's office. Practice good hygiene. It sounds simple enough, but good hygiene practices are critical to preventing the spread of the new coronavirus. These include washing hands often for at least 20 seconds, especially after coughing, sneezing, blowing your nose or using the bathroom, and before eating or preparing food, covering your mouth with a tissue or your elbow when you cough or sneeze, cleaning frequently touched surfaces such as doorknobs, tabletops, bathroom fixtures, keyboards and tablets, and avoiding sharing personal items like dishes, eating utensils, towels and bedding. Can we ever be safe from these types of outbreaks? We expect that these types of outbreaks will occur for the foreseeable future at irregular intervals. To try to prevent large outbreaks and pandemics, we need to improve surveillance in both humans and animals worldwide as well as invest in risk assessment, allowing scientists to evaluate the potential threat to human health from the virus, for detected viruses. We believe that global action is needed to invest in novel vaccine approaches that can be employed quickly whenever a new virus like the current coronavirus, and also viruses similar to Zika, Ebola or influenza, emerges. Currently, responses to emerging pathogens are mostly reactive, meaning they start after the outbreak happens. We need a more proactive approach supported by continuous funding. Recently, a group of researchers mapped out the detailed structure of the so-called spike protein that the new coronavirus uses to latch onto and infect human cells, potentially opening the door to a vaccine. The idea is that if people were to be injected with a spike protein-based vaccine, their bodies would make antibodies against it so that, if they were ever exposed to the real virus, they would have immunity. But the problem with vaccines is that it takes so long to go from the potential vaccine to the animal model to the types of clinical trials needed, and there's only so many steps you can cut out without jeopardizing safety, Choe Pena said. And so a vaccine isn't going to help with the spread of the virus in epicenters right now, he added. Still, experts think a vaccine is likely 18 to 24 months away, which is still expedited from the 10 years it typically takes, according to the Live Science report. But the fact that experts are continuing to develop a vaccine means that they don't think SARS-CoV-2 will disappear anytime soon, Epstein said. If health officials thought the virus would vanish soon, then building a vaccine for the future would not make much sense, Epstein told Live Science. there's a sense in which it may not end. Since 2003, the world has faced 3 outbreaks caused by coronaviruses: severe acute respiratory syndrome (SARS), Middle East respiratory syndrome (MERS), and now the current outbreak caused by a virus known as 2019 nCoV. Scientists have yet to find a way to stop these outbreaks before they start. Vaccinating people at high risk. During the 2002 to 2003 SARS outbreak, it took about 20 months for a vaccine to be ready for testing in people. By then, the outbreak had been contained with public health measures like isolating infected people, setting up quarantines, and identifying people who have come in contact with those who are sick. These steps are already being done in the current outbreak. Whether these can contain 2019 nCoV depends on many factors, some of which are still unknown, like how quickly the virus spreads and how serious the illness it causes is. Not being able to predict how an outbreak is going to go, it's always important to address the potential for vaccine development, said Andrus. When vaccines work, they're excellent. In many cases, they are the best way to prevent disease. Even if a vaccine makes it through all the rounds of testing, it's unlikely that drug makers can manufacture enough vaccine to protect everyone who might be exposed to the virus. That means health officials would need to prioritize who gets the vaccine. This is based on factors like who would have the most severe symptoms and who is most likely to spread the virus. With the current outbreak, the World Health Organization estimates that only around 20% of people infected develop a serious illness. Healthcare workers on the front lines of an outbreak are another group that you want to keep an eye on. If healthcare workers become infected, they can amplify the outbreak because they're in contact with so many patients, particularly individuals who might have a chronic disease, said one of the scientists working with the vaccines. This is especially true since people can spread the virus even before they have symptoms.